Good morning, it's Laura Russell, and my channel's name is Eat to Your Health with Carnivore. If there's anything that you guys want to discuss, vitamins, nutrients, lifestyle changes, keto, ketovore, carnivore, definitely like, subscribe, and there's a little bell you can hit. So if I go live, then you're notified. You can see the videos if it's something you're interested in. I always say share it out if you know somebody that has some of these issues. So what I'm going to go over today is about our D3 that we need in our bodies. So I'm not a doctor. I'm not telling you this is exactly what you should do. I am going to tell you exactly what I have done for decades to reverse my osteoporosis that I had at a very young age due to hysterectomy, lifestyle, sad diet in the early first 20 years of my life. So what I'm going to go over first is some of the things that a deficiency in vitamin D3 can cause. So first thing is if you have low vitamin D, it is proven that your immune system is going to be in the tank. It is part of what helps with the immune system. You can have cystic acne, which is definitely something I used to have. I never had acne as a teenager. I had it after I had children. It increases the risk of childhood asthma, which I still have asthma, but it's been in control for, my son's 27, so it's been in control for over 25 years. Restless legs syndrome, the pain and where you can't control your feet and your legs and you're moving them constantly at night, that can be a vitamin D deficiency, but it also can be a B1 deficiency. So if you wanted to go natural and didn't want to take any supplements, you could do lots of extra egg yolks without the egg white because it can block that B1 absorption. So you could do something like that as well. I'm not sure, if you're still eating any carbohydrates, that is going to block a lot of this. So this is more geared for like if you're carnivore, there are food options that you guys can do for these things that you'll get, you'll absorb it better. Doesn't mean it's going to get you up to that level, which is why I supplement. Not saying you have to, you do what you want. Bipolar is actually linked to low vitamin D3. Irregular heartbeats that go into and stay being AFib has been shown. There's been several carnivores that were AFib for decades that after going carnivore, increasing their vitamin D and K2, that their AFib is gone. So not saying it's going to get rid of your AFib, but it sounds like it's something I'd be willing to try. Because if they used to say that these are fat-soluble vitamins, so if you take in too much, I'm not saying do 20,000 units, but for the most part, your body is smart and it's going to get rid of excess. Pneumonia, frequent lung infections, bronchitis, wheezing, the big one, and I've seen this a lot with patients, is that psoriasis and eczema of the skin. The other thing that I have done with some of those people is I make tallow lotion from the beef fat and add in a lot of healthy oils with that. And putting that on also helps getting them off of stuff that they're allergic to, which a lot of times it seems to be lactose. So milk products really bother them. Hay fever, sinuses issues, tachycardia, which is not something you want for a long period of time. Recurrent tonsillitis, or that even if they don't get infected, if they're enlarged, they are part of our immune system. And, we're so quick to get those ripped out because they get infected and they're large. Well, shouldn't we be like, well, why do they keep getting infected and why are they so large? Maybe it's because they're doing what they're supposed to do. That's like saying, oh, my heart beats, I should take that out. I mean, it makes about as much sense. And there are times where it's so bad that you don't have a choice. But if there was something you could do to help prevent that, and almost every single human walking the earth is D3 deficient. I see it in labs all day, all the time. People in their 20s that have like low vitamin D, it's just crazy. The other thing that it can do is like, say you're pregnant and you're carrying a baby, that the baby that's developing, they can have structural developmental problems. So some of that can be like the small palate, like I had that and I had to have that expander put on when I was a teenager to, widen my palate and put braces on. Crooked teeth, jaw malformations, that's another one that goes along with vitamin D decrease. And even if they breastfeed, breast milk really is shown to only have those high vitamin D levels about the first 6 months of breastfeeding that child. So, hunchback, flat feet, bow-legged, long COVID symptoms can be two things. It can be D3 deficiency or again, that B1 deficiency. And all of the carbohydrate, sugary foods absolutely diminish both of these things, which is why we saw some people do really good during COVID, like the really old, like your 90-year-olds, they're like, wow, that was COVID? Okay. Because I think they have better vitamin D. They were outside more than we were. Their food wasn't as molested, is basically what I'll call that, for the majority of their lives. It has been for the last 50, but they had a good stand to start with. Early puberty, uterine fibroids, irregular and longer cycles, it can be 7 times that you're going to be more likely if your vitamin D levels are low. Urinary incontinence, vertigo, which is just the dizziness and can have the ear ringing. Sarcopenia, which is muscle loss, is 7% higher in people with a vitamin D deficiency. Myopia and glaucoma are 2 times more likely if the vitamin D is low. Erectile dysfunction is 1.3 times more likely to happen if your vitamin D is low. So when it comes to supplementation, what I use is a K2D3 supplement. Even though I eat 100% carnivore and actually mostly lion, I still do it just because my bone density was in the tank. It was trash at very young. And by taking that, I was able to reverse my osteoporosis. I mean, my T-score was like 3.5. And I believe it's like 0.1 now. I mean, it's like, they're like, don't come back, call us if you need us type thing, which is amazing. I mean, that's what I want for my patients and people that I know and people I don't know. I want them to not have to go on Boniva and injections and Fosamax and have to sit up for an hour and then run the risk of having the GI problems with taking Fosamax, for bones when we can be doing this naturally. So what I take is K2D3. It's 100 micrograms of K2. The D3 is 500, and you can do up to 10,000 or 5,000. You can do up to 10,000. So some of the other things that I want to put out there is, this is not how I thought it went. I thought people of darker skin with that, they have more melanin, of course, than me. I'm like see-through. I thought that they would break down and convert D3 from the sun better than I do. And it's actually the opposite. That protects them from the sun, which is good. But they have lower levels of vitamin D than we do. So this is something that I really think, everybody could go and get your D3 levels done and kind of see where you sit on that so that and you may not need to supplement. Like I said, I do because I saw what it did for my bones. I haven't seen any adverse effects of still taking it plus eating this lifestyle other than excellent bone strength. I mean, I deer hunt. I fall every single year. I find the log under the tall grass. It's got ice on it. Or I find the creek or the well we have no wells on this property. I find them every time. So I have not had any fractures in, many, 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 many years. I mean, many years. So I do think it's a benefit for people to at least kind of know what your D levels are, because it's so important. So let me see. Yeah, okay. So I was just looking at my old stuff. So what I'm going to go through is tell you what D3 actually does for the body. So it's absorption of intestinal calcium, intestinal phosphorus. These are all things that you need to make good bone. And teeth. My teeth are wonderful. My dentists are like, we'll see you in a couple years, which is okay. They'll have plenty of other patients that still drink the pop and, have the suckers in their mouth laying up against their enamel. So it helps build bones, teeth, keeps them stronger, improves mood, improves your immunity, having proper levels of vitamin D3, decreases inflammation, and improves heart function. The other thing I'm going to say about that is, a cardiac calcification score that I had done years ago was 700. And then when I was 51 last year and had been eating carnivore for 3.5 years, my cardiac calcium scoring went down to 0, which means the calcium that had been in those blood vessels had been migrated out and was put to where it's supposed to do, which is what K2 helps with. So K2 is really good for skin health, bone metabolism, helps with proper brain function, prevents heart-related diseases. It is protective. So the mechanism that I'm going to go over with D3 is what I was talking about with the calcium and the phosphorus, where, it causes the calcium and phosphorus in the bloodstream, where K2 then activates what's called osteocalcin. And that's another test you can have ran, is see what your osteocalcin is. That's a protein that's needed to deposit the calcium, starting that matrix in bones, which then draws, phosphorus and the other elements that you need to actually build bones, because they're not just 100% calcium like a lot of people think. So it helps maintain healthy blood vessels by not sending the calcium and leaving it in the blood vessels, because that's what causes your blockages. It's not liquefied cholesterol sitting in your arteries. If you think about it, if you put a slab of real butter here and fake butter here, just at your body temperature, what happens to the butter? Yeah, it liquefies. What's this one do? So I want somebody to tell me how this gets stuck and becomes rock hard. Doesn't happen. But if you have an idea, throw her out there. So it helps with the elasticity also, the K2 does, of the blood vessels, which you want. You don't want them to become hardened, smaller, because then you run into risks of like peripheral neuropathy, which is where the further away from the heart you get, the less blood flow you get down to those ends of the blood vessels, and that's what feeds the nerves. And then you have nerve death, and then you have that pain that sometimes is not, you can't fix. Sometimes you can do it if it's not completely, So the calcium in the body will absolutely not work like it's supposed to if you don't have enough D3, K2. Let's see. A side benefit of D3 is it acts as a steroid and regulates the cell nucleus to protect against cancer. That's seen. D3 is found in animals such as beef, especially beef liver, salmon, sardines, eggs, as I said. K2 is derived from fermented foods, animal products, blue cheese, like Gouda, chicken livers, butter, and ground beef. So with that being said, I do think that eating this way is probably going to help you with the K2D3. And I'm talking about the carnivore way of eating. But I'm just saying that, especially if you already have osteoporosis, penia, any of that, I really think, like I did the supplementation, and I'm going to stay doing it. My lab levels are always good. I've never had them come back being, too high or whatever. They're always perfect. I think our bodies are pretty smart. So that's what I have done. So that's just information for you. I always say go out and research. I am going to link in the description a doctor that I watch a lot, Dr. Pradip. I'm going to spell his last name because I know I'm going to butcher it. Jamnadas. He is a medical doctor and he's teaching. He's in university. And I'll put the link in there where he discusses K2D3 and its importance in the body. So hopefully that makes sense. If you have any questions, if something I said, I tried to not do it in nurse lingo as much as possible. If there's anything that you're like, I don't know what the hell that means, put it, you can put the question in the comments. If there's anything else you want me to go over, if there's a recipe that you want me to throw together and do a video for you, I will do that. I'm not sure if I'm going to do a video tomorrow. This video is actually being made Thursday, but I'm going to upload it on Friday. So I can't go live on YouTube yet. You have to have 1,000 subscribers. So I'm at 3 something now. So whatever, that's fine. And I don't care about the monetization that comes with having 1,000. I have it turned off, so I don't even care about that. I just need to get this information out for people so they understand that we're being poisoned by our foods. You know what's funny? I'm just going to go over this real quick because I was looking at an ad yesterday, and of course I just like marked the meats. But when you see what they put on sale that is just the cheapest junk, and this is a good store, but I mean, it's all this processed, everything processed, maltodextrin, there's like 70 names of sugars and junk. You got to read your labels. And if you don't know what something is, I always say, first of all, find out what it is. Second of all, I mean, I feel bad for your dog, so maybe don't do it all the time. But I'm always like, see if your dog will eat it. Because I can tell you a dog will not eat margarine. I've never found one that will, which was my first clue of, I don't think I'm going to do that margarine lifestyle. I did it for a few months when I was 19 into 20 and made myself sicker and decided we're going to go back to the old ways of doing things. But I think if you know what you're putting into your body, at least you're making a good decision, of an informed decision. It may not be a good decision, but it's at least informed. You really need to know like what you're doing. I'm a car person, so I always tell people the food and fluid that you put in your body is no different than the gasoline that you put in your car. And you want to put the best that you can afford with our economic situation that we're in right now. So anyway, I'm going to let you guys go. As I always say, meet, heat, eat, and repeat.